The integrative aspect to what we do takes place within the center and then also outside of the center. So within the center, the clinic space is a group of therapists who are collaborating together. And that's really important because we want to make sure all of the needs are being met of our patients, and really that can only happen when the therapists are going to collaborate and discuss patient care. So through the physical therapies we offer, the counseling services, and the naturopathic medicine, we come together as a group and we work together to ensure that we're providing whole person cancer care. Then when we take integrative to another level, we're talking bringing integrative out, building those bridges and links and collaborating with medicine as a whole. And so we're doing that partly in the form of our research. So we have research connections through the hospital system, but also, and more importantly almost, is our collaboration that we intend and hope to be doing more and more so with oncologists, with GPs, and with everybody else, so that we bring together all of the cancer stakeholders, if you will, within the region, and we work together on a collaborative basis. We want to really take away from that feeling of having the silos where you, as a patient, you're going here, and here, and everyone's separate and no one's really having a dialogue. So the idea is to integrate out from our center and collaborate. At the moment, what people have been doing is that they are very focused on let's eradicate the tumor. So it's a very narrow focus. It's either surgery, radiation, or chemotherapy. But there's so much more going on, and there's so many things to look at in terms of how did this disease first start. And with something like cancer, we're talking about hundreds of different kinds of diseases, right? There's so many different kinds of cancers. There's so many different reasons why it's happening. And so you really need to look at the whole person. And that involves looking at not only the tumors, but much, much more. So you want to be looking at diet, you want to be looking at lifestyle, you want to be looking at their emotional well-being, their spiritual well-being, mental well-being, all of those things. And there's so much research out there now that is indicating direct links towards the creation of disease as a result of stress, as a result of our lifestyle, lack of support networks. That's huge. There's tons of research coming out now that shows those cancer patients who have a very strong support network. So they've got good family or friends, or they've got counseling going on for them. They've got a system in place that supports them, and those people are actually living longer. They have much better outcomes when they are able to look at and focus on all of these different parts that create whole person cancer care. So we're going beyond conventional and not only just providing even just particular complementary treatments, but we want to look at the whole gamut and bring it together. And we want to be looking at the physical, the mental, emotional well-being. They all play a fundamental role in health, and that's where the integration needs to come in.